and welcome to today's session. 'Tis the season of open enrollment. So we all know that open enrollment is quickly approaching. And the question is, are you aware of the new innovative in-network benefits that are available to you today? Well, today's session is going to highlight and deep dive into our comprehensive open enrollment promotional package. One thing to take away from today's session is that Gem Sleep is here to support you during open enrollment season. So I'm going to begin by diving into our promotional package, which begins with our new employee engagement playbook. What we've done is we've created, I should say pre-created templates and communication campaigns to allow the HR team, to allow the broker and consultants and the employers to effectively communicate the benefit of Gem Sleep, to effectively communicate throughout the year and really hone in on what is meaningful and relatable to your employee workforce. So essentially, the employee engagement playbook is a toolkit that gives you everything you need to drive awareness of Gem Sleep with your eligible employees. The communication campaigns range from pure education of what obstructive sleep apnea is, what does OSA stand for, how does it potentially impact your workforce, whether that be productivity, absenteeism, and even safety. We also provide tactics to really look within an organization to understand how impactful obstructive sleep apnea is, and for those who may not be effectively treated or not effectively be treating their obstructive sleep apnea, by taking a look at the claims and again, really understanding your organization and the impact obstructive sleep apnea could have on it. We also provide a handful of different tactics to introduce Gem Sleep within your workforce, from introducing it as a new employee benefit, similar to what we're talking about today during open enrollment season, but also leveraging employee activities, whether that be participating and promoting Gem Sleep during an open enrollment event, whether that be health fairs, whether that be even biometric screenings. So again, providing the HR team, the brokers and the consultants, really some tactics that can help bring awareness throughout their workforce. And then we've created ongoing communications to drive sleep apnea awareness. We understand that every workforce is slightly different. So again, we've created some pre-written email templates that can be leveraged, ranging from safety and productivity, educating the workforce on the risks of untreated obstructive sleep apnea. We've provided treatment options and consultation efforts to share with patients that CPAP might not be the only treatment option. We've also provided Gem testimonials. I'm actually going to jump into one of the pre-written communication templates to share how easy it will be to take what we've created, take the content, and deliver it to your workforce. So again, all of the content, all of the educational information has been crafted up for you, and we have the ability to create custom campaigns by adding your logos within these communications and by really calling out a specific call to action. So this is really a quick highlight of the employee engagement playbook. This will be one of the 4 tools that we will provide you as part of our promotional package. The next tool that's on the docket is we are actually going to share with you a snippet of our pre-recorded Gem Sleep orientation video. This video is going to be sent to you. You can play this at any point during new hire orientation, during open enrollment events. But again, this will be a pre-recorded video that really helps the employees understand who Gem is, how to access Gem, and what to expect as a patient. So we'll play a quick snippet of that for you. Today, you're going to learn about Gem Sleep. You'll learn how to access this new innovative in-network benefit and what to expect as a patient. Gem Health is virtual specialty care, and Gem Sleep is our first pathway in the sleep space. We'll be focusing on obstructive sleep apnea, GEM Sleep provides a comprehensive diagnosis, treatment, and support for the 25 million Americans who are not being adequately treated for obstructive sleep apnea today. At a very high level, GEM Sleep is a virtual sleep apnea clinic. As I mentioned, that was just a quick snippet, but again, this is a great tool to have, if you will, in your open enrollment toolbox to leverage in greater promotion of GEM Sleep. So the third tool, speaking of, that we're going to share with you today is our Get Started with GEM Sleep launch flyer. What I'd like to share about this is our ability to spin up a custom landing page for our employer clients. So we simply add your logo to our communication campaigns, similar to this Get Started with My GEM Sleep flyer. And what we do is, again, by spinning up this custom landing page, we're actually able to give our employer clients a unique QR code and a unique URL. Why this is important is then it'll allow us to really drive in the messaging that this is a mutual benefit that's being offered through the employer base. This is a great launch flyer. It educates the patient on GEM's engagement model, which is, again, the clinical diagnosis, the education, consultation, and delivery of treatment options. And then, of course, our high-touch, high-tech wraparound support. And again, why this flyer is really critical to launching the GEM program within your organization is it has a very clear call to action for the employee to either click on the URL link or to scan the QR code. We're going to move now into the fourth tool, which is a sample of our aggregate reporting. Right now, I understand most employers get some level of reporting through claims, or they can search different CPT and HCPC codes to understand the impacts of sleep apnea through claims. But what they aren't getting is aggregate reporting across their entire book of business. When GEM has the ability to spin up that custom landing page that I talked about in Tool 3, what this does is, again, it not only allows us to do co-branding and customization on the communication and promotional efforts, but it also gives us reporting, which I think is critical. So that allows us to see the waterfall effect of utilization or activity of your employee workforce funneled in through GEM and this custom landing page. So what you're not getting today is data on what is the likely population that has obstructive sleep apnea, how many of those have completed a home sleep test. Of those, how many have been diagnosed with obstructive sleep apnea? Of those, how many are being adequately treated and compliant and adherent to their treatment plan? And this is exactly what GEM is going to be able to offer to our employer clients on a quarterly basis. The reporting will also help from a promotional perspective, so we can get a better idea. Is the promotional campaigns during open enrollment working? Did we see a great impact by promoting GEM during a biometric screening? Did this productivity and safety email really resonate with our population or not? And we can make pivots in terms of the best way to approach the communication strategy with your employer groups based on the data that we see here. So the question is why did we create these materials and why are we sharing them with you today? And I think it's threefold. Our objective is to simplify the communications, and this is not just for open enrollment, but throughout the year, as you saw some examples in our as you saw some examples in our employee engagement playbook. We also want to engage with your employees and educate them and build awareness of the prevalence of obstructive sleep apnea. I think a pretty alarming statistic and something that surprised me was that 1 in 8 American adults have obstructive sleep apnea. And even more critical, 80% of them are not being adequately treated. And if anyone has been in calls with me, you know, I always say that means there's a whole bunch of us walking around like zombies who are tired, who are exhausted, who are not sleeping well, probably have an ornery bed partner. And I think just really bringing the prevalence and the awareness of obstructive sleep apnea to the workforce is critical. And then to be better yet, have a call to action and really be able to drive and steer your employees to a very convenient and timely and clinically effective solution to get diagnosed, get treated, and be supported along the way. And then finally, we think it's important to increase benefit utilization. A big piece of the puzzle is awareness that this is a new innovative in-network benefit and driving patients towards these benefits that they might not otherwise know even existed. And speaking of, on to some exciting news. Your clients, your employees likely already have access to GEM. GEM covers nearly 50 million lives today. As you can see here, we have national coverage, regional coverage, and local coverage. And as a employer or a broker, if you offer any of the mirrored coverage that you can see on the screen here, please feel free to reach out to me directly, and we can create a custom communication campaign. A little bit of a tongue twister there for your clients. And then, as I mentioned in Tool 4, we'll also be able to provide that custom reporting for your clients as well. One of the things I want you to take away from this session is GEM differentiates ourselves in this space in the sense that we already have coverage and we're not looking to contract directly with an employer, but rather this is purely a promotional play. So there is no contract, there is no PEPM or PMPM, there's no case rate structure, but rather we want to work with you to promote this new innovative in-network benefit. And that's why we've created our open enrollment playbook, our open enrollment toolkit with the material that can really set you up for success and set your employees up for success in terms of their sleep apnea journey. So open enrollment season is just around the corner, and GEM Sleep is here to set you up for success. So thank you so much for joining our fast and furious open enrollment session. We hope that you found this to be beneficial, and I look forward to hearing from you.